everyone, my name is Erin and I am a registered nurse. I currently work on a cardiac floor in the hospital setting. And the topic I'm going to talk about today is working on fall prevention, striving for a change within this particular issue that we encounter a lot with our patients every day. Unfortunately, falls are way more common than what we would like to see them be, and that can happen for a variety of reasons. It could be due to disease process, medication changes, or just simply being out of our normal environment where people the walk from the bed to the bathroom might seem like the simplest thing, but just being out of our familiar environment can cause us to become disoriented and potentially have a fall that could have serious consequences. So fall prevention is something that I'm very passionate about. I started my nursing career as an LPN in a nursing home setting, and unfortunately many of times I saw my residents sustain a fall, and that was, ultimately what led to the continued downward spiral of their overall health and well-being, and what ultimately led to their passing. Of course, we can't always say, for sure something that happened 6 months ago, but, it's easy to see pinpoint where the issue started and the problems that continued to happen after that. So a fall is any unintentional descent to the ground, which can be either the individual by themselves. Sometimes there are staff-assisted falls where it is easier to help lower them to the ground if you are witnessing it about to happen, as opposed to causing further injury to them or to yourself by trying to keep them upright. Sometimes an assisted fall is the best option, but it is still considered a fall. So falls can lead to serious consequences, including physical injuries, psychological impacts, and extended hospital stays, and that can compromise patient recovery and overall health outcomes. By creating a safe environment, conducting our proper assessments, and educating both patients and their families about fall prevention strategies, nurses can contribute to enhancing patient safety and promoting better healthcare experiences within the hospital context. To prevent falls in the hospital setting, various strategies and tools are commonly implemented to enhance patient safety. The use of non-slip socks are often provided to patients to minimize the risk of slipping on floors. Bed alarms are another preventative measure, alerting staff when a patient attempts to get up without assistance, thereby enabling a timely intervention. And hourly rounding by nursing staff serves as a proactive approach to assess patients' needs and address discomforts and ensure that personal items are within reach, which can help reduce the likelihood of falls. So, I was trying to think of what is something that we can do to help implement a change in fall prevention. And, as nurses, we have so many things on our plate, so many balls that we're juggling in the air at one time. So it needed to be something that could be simple, that was attainable, and something that would have kind of like a paper trail to be able to help with encouraging the use of it to help with fall prevention. So I came up with the idea of implementing a standardized checklist for nurses to use during their shift change, as I thought it would be an effective way to ensure that appropriate fall prevention methods are consistently being applied to each patient. Consistency is key here. The checklist could include key items such as verifying the presence and condition of non-slip socks, assessing the functionality of bed alarms, confirming the accessibility of call buttons, and reviewing individualized care plans that address specific fall risks. The checklist could prompt nurses to perform a quick environmental assessment of the patient's room, ensuring that floors are clear of obstacles and necessary items are within reach. By using this checklist at each shift change, nurses can promote accountability, enhance communication between shifts, and support a systemic approach to fall prevention that ultimately aiming to minimize the risk of falls and enhance patient safety. References that were used for information within this presentation, and thank you for your time.